My name is Isidore Kpotufe, the Chief Executive Officer of Rivia Technologies, also known as Riviaco or just Rivia. Rivia is a healthcare network of clinics and very soon diagnostic centers that offers membership-based care to individuals, families, and businesses. Rivia as a company partners with existing healthcare facilities, provides support to upgrade these facilities to meet Rivia standards of care, offers technology to digitize the operations of these facilities, and most importantly, offers technology that links all the healthcare facilities in the Rivia network. No sector has been immune from the advancement of AI, and so you see that there have been many use cases of AI in the healthcare sector in Ghana. So some cases of that as well, where we have different colleagues, proposing different use cases for AI in diagnosing certain diseases, AI in reading medical reports, AI in serving as the first level of intervention for patients seeking information on certain conditions. We also saw some deployment of digital solutions. So digital health or telemedicine has been another area of impact for healthcare. Digital infrastructure is one. In many parts of the country I travel to, so many remote parts of the country I travel to, there is lack of internet service. Places as close to Accra as the eastern region, the western region, the central region, they don't have access to stable internet. So I do not see how we can make healthcare inclusive or digital healthcare inclusive when the people who are most excluded from the healthcare ecosystem, so these are people in the remote areas, don't have access to the digital services to access digital health. We have challenges with the adoption of health insurance by patients. We have challenges with the claims payment and refund processes of health insurance companies to healthcare providers. So we have significant challenges around healthcare financing. On the provider side, we are in the business of working with clinics and operating a network of clinics. One of the core challenges we've seen is a lack of financing to healthcare providers to procure inventory, to access equipment, to pay caregivers, and the lack of financing to providers is impacting on the quality of care that patients receive. The government has to have a mind shift, or mindset shift. We should not be in the business or in an environment where government builds the infrastructure, run the infrastructure, and is responsible for interfacing with patients in the healthcare, in the healthcare ecosystem. That is not sustainable. In fact, there are 10,000 healthcare facilities in Ghana, for 35 million people. 80% of these facilities are government-owned. So government-owned in the sense that government has built the infrastructure, either through public-private partnership or directly on the balance sheet of government. And government is running this infrastructure, so we're responsible for employing the caregivers, responsible for providing the service to patients, and it's also responsible for interfacing with patients through the NHIS. Governments must embrace public-private partnership, especially in the area of infrastructure. Government must partner with, technology players to advance access to digital care, and most importantly, partner with telecom service providers to take digital access to digital services in areas where there isn't internet access. And we've seen some partnerships with telecom players, like we've seen, for example, MTN and at the time Vodafone coming together to collaborate on roaming in certain parts where both players couldn't go individually. So we need government to be in this business, providing the necessary environment for the different players in the space to thrive. We don't have a population that has a very good health-seeking behavior. I would explain this. In healthcare, there are different levels of care. There is primary care, there is secondary care, there is tertiary care, and there is quaternary care, just like you would have in education, for example. Primary care is the first level of care that anyone would need when they are not well. And yet we see that people do not engage with primary care. They only engage when they have secondary level or tertiary level conditions, which is very expensive because the further you go in the value in the care delivery journey, the more expensive it becomes. So we need government to help educate the populace on the importance of engaging with the healthcare system early on in order to bring down the cost of care. In the case of healthcare institutions, for example, there is an agency that has been set up to regulate healthcare institutions. But telemedicine, the scope of telemedicine or digital healthcare in the framework of this institution, which is called HEFRA, is not well defined. So you find that some players with certain innovative digital solutions are not able to fit in, making it riskier for investors to back innovations like that. So we need some level of intervention or harmonization from governments, in this area. In August 2023, I went to a clinic in Accra, somewhere in North Kaneshie, in Accra, to seek healthcare for an ear infection I had. As soon as I got to the place, I saw an old building, a dilapidated building, and I was wondering if that was a clinic, because it didn't seem like, it was a place of healing. But because of the pain I was in, I went in, and the environment of the clinic was very disorganized. To my luck, I met a physician who provided competent care. And so we started the conversation out of that experience. In fact, I took a trip around different neighborhoods. I took several trips, to several neighborhoods in Accra, in Greater Accra. And to my surprise, many clinics were in a state that was similar to what I had experienced with this clinic I visited with my ear infection. So I came to the conclusion that this was the reason why some people, at least, did not have confidence in the healthcare, services that they would receive from clinics, because these clinics did not project, the infrastructure of these clinics did not project confidence. The in-clinic or in-person experience of these clinics did not leave a good impression on patients. So we decided that we would build a business that was not, for me as a technology, that was not easy to do. We decided that we would build a chain of clinics offering personalized healthcare using technology to patients based on a membership model as well. This is not really interesting because I'm a technologist, and some of the people I would typically go to finance a business like this are venture capitalists. And one of the cardinal sins of venture capitalists is to back a business that is asset heavy, that has to rely on real estate, that has to rely on, the owning assets, because these businesses have proven not to be able to scale, to scale historically, or at least they take a longer time to scale. We decided to make a very difficult decision that, look, no amount of telemedicine, no amount of digital innovation would suffice if the infrastructure at the core of healthcare was not enough. Because all over the world, 9 or more than 95% of healthcare services happen in person. Even in the most advanced economies, including the United States, where we see, very good adoption of digital healthcare services, over 90% of healthcare services happen in person. So if you build a marketplace or a telemedicine platform, for example, and you offer the first level of care to a patient, and at some point they would need to go to a clinic or a hospital, what happens if they go to a clinic or a hospital and the experience is not great? We still have not solved the problem. And so that is where we decided to position Rivia, to build very sufficient infrastructure, very beautiful clinics that offer different kinds of experience, in-person experience for the patient, and then use partnerships as a scale framework to grow this business. So in most cases, we don't own the real estate infrastructure, although we are involved in the real estate infrastructure. We will do this in 2 ways. We will either partner with existing healthcare facilities and upgrade them to meet the Rivia standards. We will give them technology to digitize their operations and link them to other Rivia clinics, and then give them our brand. Let me speak from a patient perspective. When you walk into a healthcare facility or a clinic or a hospital, and the in-person experience is not great because the infrastructure is inadequate, studies have shown that it would have impact on your outcome, on your healthcare outcome, what we call the patient outcome. In other words, the in-person experience or the infrastructure or the environment of any healthcare service is as important as the clinical service. In fact, some studies have shown that some people get immediately better as soon as they walk into certain environments because of the choice of colors, because of the choice of lighting, the choice of layouts. These things have significant impact on the healing process of humans. So Rivia's impact is making healthcare outcome significantly better for patients. That is one. Two, from a competitive point, Rivia is playing in the offline market and the digital market because we have clinics branded by Rivia offering better in-person experience to patients across the country. So we are winning trust offline, which is important in digital adoption on the continent. In fact, studies have shown that many e-commerce platforms or many e-commerce innovations have struggled on the continent because of trust. Right, and so one of the ways to increase trust is through offline presence, which Rivia is doing through the partnership with clinics and our footprint of clinics across the country. The first challenge is having to partner with different players in the healthcare space and asking them to standardize their service delivery. That is the big challenge because we're dealing with people with different mindsets, different exposures, different backgrounds, different beliefs, and different aspirations for their business or their businesses. So that is a difficult feat to achieve. Nonetheless, it is not impossible. At least we have proven that through consistent engagement with healthcare players and our partners, we can standardize the care delivery regardless of the location or regardless of who the practitioner is. So that's the first challenge. The second challenge is the capital constraint. Because we have to make upfront investment to upgrade or to improve the in-person experience at the clinic's level, we will require more capital to do that. And we operate in a capital constraint environment. The third challenge would be how we combine the relationship between because there are some patients who go to the clinics without having a prior relationship with Rivia. And so how do we transition that experience, which is happening at the clinic somewhere, it's somewhere very far from our headquarters, onto a digital experience? So that is another challenge that we deal with. But for us, we see this as opportunities. We have had to innovate our business model on the back of these challenges, and I think these challenges have given us even stronger moats, stronger competitive edge, because we are solving around them. We launched our first clinic in February/March last year, and 10 months later, so by the end of December, we ended the year with 8 clinics. We have the first Rivia-owned clinic in Jolu. We have the first dialysis clinic in the network as well, which is the only private dialysis center in the Eastern region. So there are only 2 dialysis centers in the Eastern region: the government dialysis center and the dialysis center in the Rivia network. We provided care to, our clinics provided care to over 40,000 patients. And so these have been remarkable achievements for us, and that we are very proud of. As the cost of delivering care increases due to inflationary pressures, and access to care for patients gets also more expensive, we believe that by benefiting or leaning on the principles of economies of scale, we can bring down the cost of delivering care, and which will benefit everyone at the end of the day. Benefit the patients, which means that we'll see more adoption of healthcare services. So consolidation is an opportunity that we've seen, both in the traditional sense of the word and using partnerships. We also see many opportunities in new care delivery models. So one of the things we do at Rivia is a membership-based care. Membership-based care means that you have a membership with Rivia, and the membership gives you certain benefits like free consultations in person, free virtual care, and discounts. So we're seeing that many patients are avoiding expensive healthcare premiums or healthcare insurance premiums because it's really expensive. And so they will lean into new care delivery models like this, where this helps them to bring down the cost of care, and then they can also have some insurance-like benefits. We see advancement in digital healthcare, although we would need digital healthcare to blend in with in-person care. So we see that as well as opportunities in Rivia is positioning itself to take advantage of these opportunities. We are already in the business of consolidating clinics. We are already offering membership-based care, which is bringing on the cost of care to patients, particularly to organizations. Many companies in this country want to offer some healthcare benefit to their employees, and they are not able to do that because of the cost implication. And so thanks to innovations like what Rivia is offering, companies can do that for the first time. Access to digital care is also important, and so we see some investment in that space. We see that AI will do 2 things for the industry. It would increase access to care, and then we reduce the administrative burden on care providers. we connect all the clinics to our proprietary software called Rivia OS. This is the software that all the clinics use to manage their operations. This is the software that all the clinics use to interface with patients. Patients we call members. And as a patient, if you go to a Rivia clinic in North Kaneshie and you happen to find yourself in Kaswa, in the central region, we have a clinic over there, and you needed care, you would continue your care in Kaswa as a Rivia patient or a Rivia member as if you had been there before, because your data is already shared in the Rivia ecosystem. And so this is really, and this would not have been possible without cloud technology. So cloud technology is important in linking the healthcare ecosystem. We also see that, like I mentioned earlier, AI is having a significant impact on healthcare delivery, especially on relieving healthcare providers of certain repetitive tasks, repetitive administrative tasks. We estimate that in the next 3 to 5 years, AI would increase the productivity of our providers by 50%, if not even more. And so that's some great innovation over there. We are pioneering a business strategy called embedded healthcare. Embedded healthcare simply means that on the provider side, so on the facilities or the healthcare facilities providing care, we are able to embed these facilities in the places you live. So think gated communities. And there are so many gated communities in this country, and they don't have any clinic inside them. So we are innovating this, where we would put clinics inside gated communities. And think shopping malls. You would have clinics in shopping malls or even supermarkets. Think schools. You might have clinics in schools. So we are pioneering what we call embedded care on the provider side. On the patient side, imagine going to a hotel, and as part of your hotel booking, you have a Rivia membership, which offers you free consultations, free access to virtual care, free medications and lab tests. So one ought not to have left that experience or not necessarily engage with a traditional healthcare provider in order to access care. So that is the business strategy that Rivia as a company is pursuing. Embedding healthcare facilities in the places people live, play, and work. And bringing healthcare services closer to patients by partnering with other services they use all the time. Imagine using a ride-hailing service, and in that experience, a healthcare membership is embedded in it. So this is what we're talking about in terms of strategy. Now, when we look 5 years from now, we are talking several hundreds of clinics in the Rivia network. And we are talking other healthcare services in the Rivia network as well. Today, we're starting with clinics, but we have strong interest in providing end-to-end service across the healthcare value chains, from doctor's visits to pharmacy to diagnostics. So you should expect to see over 500 facilities across different part of the continent. So we're talking beyond Ghana, but also most importantly beyond the continent, beyond Africa. We're looking at markets like Asia and South America. And so this is what the future looks like for Rivia.